So let's go to the another case. This is a case where I'm not showing you history or morphology because that will may bias you. Also, let's see. We have this case where we already designed the template. There are few gates and few dot plots already there, which saves you a lot of time. So again, our first four plots are common. You can see we have time gate plot which shows smooth acquisition. Then we have excluded doublets here already. Then we excluded non-viable cells by using viability gate on forward scatter and side scatter. And we have checked the distribution of 45 versus side scatter, which gives you some idea that okay, the things look as expected. From here we start with viability gate. We can start with viability gate, and as we mentioned, as I mentioned you earlier, we have two three combinations to identify plasma cells. We can go with we should evaluate using 38 and 138. We should evaluate using 38 45. We can also look for the 138 and 45, series 138 and 45, and then finally the combination which gives one combination which covers maximum cell, and the other combination we exclude the unwanted debris. We use those two combinations, and then finally get the get the plasma cells. How do we do that? So we start with here with 38 and 138. Look around that first, or we can start with 38 and 45 first. I think that is the best idea to look at 38 and 45 first, and then identify one V cells which are okay. So here I'm going to put viability gate again. We start with viable cells here. Okay, now this looks kind of not very clear. If you look at very carefully, we have few cells which looks like 38 positive and 45 negative, and there is a small cluster which looks 38 positive and 45 moderate, and these certainly are appears to be plasma cells, and there are other cells also. So with this our prior experience and everything, it looks like we should get here to identify plasma cells like this, and we can of course color them so that we can track this population with the same color in the other gates or in other combination. So let's give it dark green color, and these are with the cells which are 38 and positive 45. Now let's see how these cells looks with when we 38 and 138. So let's see here again viability, and it looks like we have covered most of the cells. It looks like we have covered 38, this 138 or green color. But let's to check out whether these all cells are covered here. We will give a color to 38 and 138 just to cross check that our 38 and 45 population, 38 to 45 combination did not miss any plasma cells. And if after coloring and readjusting the gate, it looked like there were few cells which were not included in this gate. So we now readjust the gate. This is also can be called as a backgating. And possibly in this population it looks like 38 has been down regulated up to some extent because they are coming here. So uh, but if you down regulate, you can see there are few cells which are not plasma cells also getting. So that means if we use only this gate, this 38 and 138 looks pretty clear as compared to the 38 and 45. So what we can do is we can, as a broad gate, to include all events, we can start with 38 45, and then we can choose 38 and 138 to exclude the rest of the cells which are not plasma cells, and then confirm the gate plasma cells, number of plasma cell events in this sample. So I'm going to use this gate 38 45 and apply in this plot. we have 38 and 45 PC, you can see here. So we included most of the cells, okay, and we have not excluded anything else. You know what, let's keep that way. Let's choose another gate like here or this gate. So we have 38 and we have included all the plasma cells which way we have given purple color just for the moment. Let's switch off this color to confirm, just to check. And these were the cells which we have covered. So this is how you confirm that, by the both combination, that you are not excluding any cells. So we're using 38, 138 and 45. We know that most of the cells are there, so we can use this gate and just confirm this gate in the next plot. So what I'm going to use this, uh, I'm going to put this gate of 38 versus 45 here and look for 38 versus 45, and it looks like these are the plasma cells and these are the cells, not plasma cells, which are being included in the gate of 3845, which we can exclude uh, easily now. So here, sorry, something happened to this gate. Let me readjust it. Okay, there's something happened. So this is something annoying thing in Kaluza, that every point it starts, wherever you click it start new point, and you have to adjust these points. Anyway, so we finally include the selected plasma cells with using, now we here use 3845 and now 13845. So we have isolated these cells, plasma cells. Okay, and we use this 13845 to use or confirm our final plasma cells. So here 13845, and we can further, if you want, the another way is to confirm whether you have anything junk or anything in these plasma cells, is you can look at the light chain also, so or other markers also. So you know that these are the cells and you can get these cells finally as a plasma cell, as a final plasma cell, or okay, so these are our final plasma cells where we'll put a gate saying that these are our final PC. So this is our final PC gate. Okay, once we have final PC gate, then we can start evaluating whether these plasma cells are clonal, polyclonal, or combination of both. One more step one can do is to exclude if there are some debris of plasma cells. So these final plasma cells can be put here, and look for if there are degenerating cells, and you can see there are no degenerating cells because we have applied viability kit earlier only. So we can start from here, We can also look we can also look at 38 versus side scatter also. So sometimes you can have granulocytes which can fall here and which are actually not plasma cells. We can see here, and then very high side scatter and 38 very dim. So this part can be excluded by using side scatter versus 38, and we can label this as a we can also exclude if there are if some B cells are present in your gate. In this gate it is unlikely, but the other way, if there are a few B cells, like sometimes if 138 dim to negative population we have included in our 38 side scatter gate, they can be there. So we can also look for whether there are any B cells mixed in this gate. So we can look at 38 versus side scatter in this 38 versus side scatter PC and see to check. So it looks like there are few cells which are both 19 and 20 positive. Possibly they are not true plasma cells, because one thing is there, if the plasma cells are showing aberrant expression of 20, they never express 19. So you can comfortably exclude this population in which both 19 and 20 positive. So possibly this is just few degenerating or junk which is going diagonally, which is binding to both 19 and 20 that way. So we have excluded the population with very high side scatter here. We have also excluded the population with both 19 and 20 positive, and then we have included the pure population of plasma cells. So we can call it as a clean plasma cell, clean plasma cells. And we can use this clean plasma cell to look for whether how is their maturation pattern, what is the clonality. So upfront we will look first clean plasma cells, what is their clonality upfront, whether we can see any clonal population to, or if we see polyclonal population, then we have to look for the multiple markers to identify any small abnormal population and then confirm their clonality. So if I take clean piece clonality, here upfront you can see almost all plasma cells they shows kappa restriction, and there are very few plasma cells, 0.4% plasma cells, they are lambda restricted, indicating that all plasma cells are basically clonal plasma cells here. So which confirms that this is possibly a case of multiple myeloma with a large number of plasma cells in it. And then further we can look for the different combination like 1956, 1945. So let's check out that what were the aberrancies in this. So if we look at clean PCs and 1956 or 1945, you can see these almost all plasma cells are 19 negative. Only a small population of plasma cells is 19 positive, and rest of the plasma cells are 45 dim to negative and 19 negative, which looks abnormal, and this small population looks normal. So we can get this population and check its clonality to whether these are normal or polyclonal, and the rest of the population also to check whether those are clonal or not. So if we take these and we can label them is 19 positive, 45 positive plasma cells, and look for their clonality. So they are polyclonal. Okay, so even the small population which is percentage of this plasma cell looks like only 0.8% of plasma cells, and this is important because if you have more than 5% according to some literature or 10% of normal plasma cells, those multiple myeloma shows better prognosis as compared to the myeloma with more than less than 90 more than 95% clonal plasma cells, or less than 5% of normal plasma cells. So this clearly has a less than 5% of plasma cells, and in fact the myeloma which has more than 5 to 10% of plasma cells, 5 or especially more than 10% of normal plasma cells, those are called as a myeloma with MGUS like signature, and they have shown better outcome as compared to the other myeloma. We can check, there is small population of 19 negative and 45 positive. We can check the nature of it. It looks as a clonal, so even they have some 45 expression, they are still clonal, so they are not polyclonal, and the rest of the population is it looks like abnormal. So let's give the rest of the population a different color. it's a red color, and call them and then confirm their clonality. Okay, and this population is 19 negative and 45 also mostly negative, so we'll call 19 negative 45 negative here. And look for 19 negative 45 negative, and almost all cells are clonal. Nicely 99.45% are clonal. Okay, so this proves that these abnormal plasma cells are abnormal and clonal. And just for the confirmation, further evaluation of this data, let's see what was the expression pattern of these plasma cells in 1956. So you can see the polyclonal plasma cells which are here, they are 19 positive, 56 negative, and the clonal plasma cells are nicely 56 positive, and they are 19 negative. We have other markers like 19 and 27, so we can look into that also. 19, this clean PC, you can see those plasma cells which are normal, they are predominantly 27 positive, but abnormal plasma cells are predominantly 27 negative. And this is how 27 helps you to identify abnormal clonal plasma cells. They are 27 negative in contrast to that of normal plasma cells. The other marker which is shown to be useful is 81, and we can look at the 81 also. Now in this case you can see here the normal plasma cells are 81 moderate, but the abnormal plasma cells are partly positive and partly negative. Now this type of cases where plasma cells are 81 positive are also considered as a abnormal plasma cells basically. Not abnormal plasma means the poor prognostic myeloma. So the Spanish group has shown that 81 expression is associated with poor outcome in multiple myeloma. So in MGUS, the most in MGUS or MGUS like signature myeloma, the 81 is usually negative, and even it is positive in less than 20% of plasma cells. So this is how we looked at different markers in this tube. We have another tube which I'll also show you. So before starting with this one, so let me start with basic this one gating strategy. So I will start with some empty gate so that everybody can follow the approach here. Okay, so I just emptied all the plots to demonstrate again one more time analysis. We start with uh, singlet followed by viability gate. Now just in earlier I forgot to mention something which I should have. For the kappa and lambda, whether it work or properly or not, we can look also at lymphocyte B cells, and we have 45 lymphocyte gate here. We can look into the B cells. We have these are the B cells, and we can look because B cells are polyclonal, so we can check that whether these B cells are polyclonal or not. So we have this B cell gate. You can look into B cells, and you can see these are nicely polygonal B cells. So this scale got compressed, that's why these cells look like that. So I'm trying to loosen up this scale. Okay. So this is the internal control for whether your light chain has worked properly or not, because you have internal B cells which are nicely polygonal. The other use of this looking at B cells is if you have clonal B cells too, like Waldenstrom microglobulinemia, where you have polyclonal B cells also, or lymphoplasmacytic lymphoma. But coming to the next tube, that is, we started with the singlet gate, viability gate, and we have 45 side scatter look. This 45 side scatter looks better, and viability gate also looks better, because in this gate there was no cytoplasmic processing performed. So in this, that's why it looks nice. In cytoplasmic processing, it's kind of compromised side scatter partly, so that's why they may not be that separate. So we again start with, okay, now in this tube I just would like to mention we have added 319, which also we are studying right now. For last 3 years we have studied, and not only myeloma, we have shown that this 319 is helpful in 85% of 85 to 90% of cases of myeloma. But what we are evaluating this marker for MRD monitoring, especially as an alternative marker for the gating strategy in MRD samples. So we start with either 38319 or 3845, and so we can use these two markers. So we use this viability gate. Again, we start with viability second tube, and then we look for the marker. So you can see there, there are cells which are nicely 38 positive and 319 positive. They are nice bright population. They are 3.2% plasma cells in earlier tube. Let's see what was the plasma cell percentage. This was a rough, so let's see roughly what was the percentage, and it was 2.3, so which is more, so it looks like quite right in both tubes, because this has no additional processing for cytoplasmic, so number of plasmas usually is higher. It may be different and as compared to the other tube. So we have this population, and then we can choose this population, and then we confirm with other, or we can look for the first this population in the so we can confirm with 38 and 45 again. We first label this population with some color and track this population in different populations. You can see, so we have this population which is coming from, so we have 38 population, and it's going up to here. So you can see this, if we adjust the gate in such a way so that we can include all this population, and then we apply this 3845 gate on this gate. So we will probably include all the plasma cells present in the sample. You can see there is some compensation issue. You can see there is some under compensation. We can of course compensate this part little more. Okay, so this is how we do. And so what we'll do, we start with this again 3845, and then we apply this gate here to purify or clean the plasma cells. So we have 3845 PC, we apply on this gate, or we can arrange this plot chronologically here. Okay, now we have 38 and 45 PC first gate, 38 45. Usually it is good to start with 38 and 45, and then readjust the gate as per the. Now you can see 38 45 we have included a lot of unwanted cells, and with 319 we can identify like the same way like 318. So we can include all these cells as a plasma cells. You can see here there are a few cells here. Okay, so these are our plasma cells, final pure plasma cells, and we can label them final PC. And then for look for, so we know these all plasma cells are cloned already, but we can look for the different marker expression using different whatever here they are here. So let's start with that. So we can use this gate final PC. Where is final PC gate? Final APC. uh, we are using the final PC gate, right? No, did not take final PC. Now it is fine. So here we have final PC gate, and then here we can look into the different markers like 28, 27, 200. Of course we know that 56 was abnormal. So we had few cells which were normal, that is 19 positive, 56 negative, these were normal plasma cells, and the rest of the plasma cells were abnormal. Okay, so on that basis, we can just study the different markers. Here, this is an example of some undercompensation. We can compensate a little bit more. Yes. So, but here you can clearly say these plasma cells, as compared to the normal plasma cells, which are 19 positive, 56 negative, 200 was negative, and here the 200 is positive. So, abnormal plasma cell shows homogeneous expression of 200. It shows variable expression of CD117 and variable expression of CD28. So these are the different markers which further confirm the clonality of the cell. Although in this case it was not needed, but it's good because even 117 and 28 has been shown to be associated with prognosis. The cases myeloma patients which has 117 positive but 28 negative are relatively better, and then the patients, the myeloma samples with both expression of CD117 28, they show intermediate prognosis, and the samples with 28 positive but 117 negative shows poor prognosis. So this is another tube which confirms the diagnosis of the second case. So this is you confirm. This is how you confirm in all the cases. We generally in reports we mention that morphological and immunophatic evidence of plasma cell neoplasm. If you have more than 60% plasma cell, you can say it is multiple myeloma, or you can advise always. But we always give comment as abnormal plasma cells, total percentage of plasma cell present in the sample, and percentage of abnormal plasma cells present in the sample, and the remaining sample for will be clonal will be polyclonal plasma cells. So that's how we can. In this case, it was 90, almost 99% plasma cells were abnormal. So here we go. So 99%, 99.3, because zero point 0.7 to zero point 0.8 were normal plasma cells. So this is how we give the report. Okay. So this is the end of second case.